And good afternoon, Charles Moscowitz. Thanks for joining me, everyone. The topic, of course, is the only topic that we really can talk about at this time, which is the pandemic and the best way to deal with that. What the country is going to be looking like going forward, and really, in this sense, how we can protect our health. And to help us do that, we're joined by Dr. Elizabeth Lee Vliet from the Vive Life Center. Dr. Vliet, thank you for joining me this afternoon.
You're so welcome, Charles. Thank you for having me.
Now, before we get into the topic at hand, could you give us a quick thumbnail on your work at the Vive Life Center?
I'm in preventive medicine. So, of course, preventing illness and disease has been the focus of my work. And I also work with the endocrine aging from puberty to late life in men and women, and how changes in our endocrine system or our hormones actually affect all of our body systems, not just reproduction, sex function, having babies, or that sort of thing, but how it all works together to affect everything about our health. And I take an integrated approach with lifestyle and wellness and exercise, nutrition, prayer and meditation, and properly managed medication approaches as well. So it's been a fascinating journey. I want to share with your listeners that I am an independent physician. I have no financial ties to any health system, any insurance company, or any pharmaceutical company, or any political party. I answer to my patients.
That's wonderful. I mean, that's in other words, you don't have to be beholden to big government medicine. You can treat your patients based on your experience, your education, your instinct, what you've learned, and in the old-fashioned way, like the old days when the doctor would show up with a black bag and treat people that he had known or she had known for generations.
Yes, and I actually I have patients that I've worked with for 35 years. So I tend to have long-standing relationships with my patients. I resigned from all insurance contracts in 1986 because I thought they were making me choose between what the insurance guidelines wanted done and what I thought and what the patient wanted and what I thought the patient needed. And so I said to my husband, I can't sleep at night if I can't serve the patients to the best of my ability. And so we're going to have to try and make a go of this and answer to them and not what the insurance company or the government or anyone else was trying to dictate. And I really do think that third parties and the third party intrusion into the practice of medicine is part of the reason that we have a lot of the problems we have today, and some of the reason that we're seeing higher deaths with the COVID outbreak in the United States, despite of our sophisticated medical system, compared to countries where there's more frontline decision making between the doctor and the patient.
Interesting, and certainly you're someone who's true to your calling as a physician, and besides the Hippocratic Oath, do no harm. You're functioning based upon, again, what you know, which I think is an important message. I hope that other doctors take that message to heart. I think actually there are growing numbers of doctors who do. So I want to go to the pandemic, and you mentioned that maybe Americans are not in as good a health as we might otherwise be, which is why we are seeing more fatality than perhaps other countries. If you look at a per capita population versus ratio versus the numbers of deaths from this terrible disease. Why is that, do you think?
Well, one of the big factors that is a difference between countries that are showing lower death rates per million than we are showing is that they actually are using hydroxychloroquine with or without azithromycin. They are using it very early in the course of the illness, and our model, in mostly related to political interference from governors and from entrenched bureaucrats at the FDA, one in particular, Rick Bright, who issued the emergency use authorization March 28th, restricting hydroxychloroquine to hospitalized patients. We are waiting until too late in the illness to get the maximum benefit with this medication. I'll give you a quick example, Charles. Hydroxychloroquine, in studies going back to 2005, 15 years ago, at the NIH and CDC, they found that chloroquine and hydroxychloroquine actually act very potently against SARS-CoV-1, which was the pandemic that came out from China. It was released in 2002, 2003 timeframe, broke out in China and spread around the world very rapidly. And they found at that time that chloroquine actually prevented the virus from attaching to our cells and prevented the virus from multiplying inside the cells. And they explained all of the mechanisms of that. You can find the article very easily on Google. I looked it up, I read that, and I thought, well, that's really interesting. It makes sense. And so it's kind of like locking your house to prevent a burglary.
Mm-hmm.
If you give hydroxychloroquine very early, preventively or early treatment, first 5 days of symptoms,
right,
you actually help block the virus from entering the cells, and you block the replication, which means someone's not spreading the virus as much and they're not infective as long. That's how South Korea, China, India, Israel, Costa Rica, Brazil, France, Switzerland, a lot of the countries that began taking the old basic science studies and applying them in COVID-19 or SARS-CoV-2, which is the scientific name.
mm-hmm.
That's how they got control of their outbreak really quickly and prevented as much spread and as many hospitalizations and ultimate deaths. Because once the virus has taken hold in the body, it's kind of like if somebody breaks into your house and steals all your valuables, it's a little late to lock the door.
Right, right, yeah.
That's when the model in the United States, because of these political restrictions rather than medical decisions with doctors and patients, that's what's happened here. We have too much restriction against using hydroxychloroquine early in the first week of symptoms when it's most effective, and they're using it only in the hospitalized patients for the most part. And New York, for example, Cuomo issued the most restrictive order in the country. He required patients in New York to be in the hospital on a clinical trial before the doctors could prescribe hydroxychloroquine. Well, you know as well as I do, in the midst of a massive outbreak like this, with doctors and nurses on the front line just trying to keep people alive, they don't have time to set up a clinical trial and go through all the approval process. So that was an unnecessary restriction. That's one of the factors that led to so much outbreak and deaths in New York.
Okay, I mean, that's a very serious charge for sure. And I want to just talk a little bit about what I know about hydroxychloroquine as not a doctor, just as a regular layman here. And that is, first of all, that it exists in nature. You find it in quinine water. It is was isolated and was used as a drug starting in the 1930s for as chloroquine for malaria. In the 50s, they began to use it to deal with rheumatoid arthritis and lupus. I just saw a historical reference to this. I'm reading a book about the Dreyfus trial, and when Captain Dreyfus was sent to Devil's Island, his wife wrote him a letter saying, "Be careful of catching fever. Make sure you take quinine." So it was kind of known even back in the 19th century that this was the best way to reduce fever in your system, and therefore the best way to reduce virus. So we're not talking here about something that's an extremely dangerous drug. Now, having said that, there are obvious possible negative side effects to any drug. That's why they're prescription. That's why you go to a doctor. That's why you get supervision when you're taking it. Hydroxychloroquine is no different than that. and that it has to be done under medical supervision with a prescription. Now, I want to talk a little bit about the politics of this. Therefore, since by the way, why did they say that it's never been tested in a clinical trial if it's been used for the past half century? I mean, it's obviously been used by millions of people in that time.
Well, it's actually been prescribed for hundreds of millions of people around the world. The CDC website, your listeners can go and read the CDC fact sheet on hydroxychloroquine for malaria. They talk about it as being a very safe medicine. They talk about it as having relatively minor side effects, nausea, vomiting, diarrhea, maybe a headache. And they suggest that you take it with food to minimize the side effects. CDC website for hydroxychloroquine fact sheet on use in malaria doesn't even mention the cardiac arrhythmia that is being hyped now and exaggerated now. The FDA database has 62 cardiac deaths reported out of 50 million prescriptions. That's an incidence of
That's incredible, yeah.
0.2 per million. So the side effect of a cardiac death, and this has been grossly exaggerated in the media in terms of how serious that is, it's actually a rare side effect. It tends to occur at higher doses than we use for COVID-19, and it tends to occur in people who have other problems. And so the doctors that are prescribing and have been prescribing for decades, people that take hydroxychloroquine for lupus and rheumatoid arthritis are on it for 10, 15, 20, 30 years. I have patients in my own practice who've been on it for 25 years. So they are taking higher doses over a longer period of time. And yes, you do monitor for side effects. But the thing is that it's been so safe from a heart standpoint that the rheumatologists who typically prescribe it for the lupus and rheumatoid patients don't even require a baseline EKG before they start it. Charles, am I
yes.
just dying?
No. It's things are going very well. Now let me ask you this. Therefore, I want to get into the politics of this. Why would our state governments and our media be against this drug?
Well, it has become very politicized. As soon as President Trump correctly reported, I heard the press briefing, I know what he said. As soon as he correctly reported what I was also seeing as a practicing physician coming from other countries about the success in COVID, treated early with all these other countries using it, he talked about that. He said this older medicine already FDA approved. It went through clinical trials for FDA approval for these other uses, perfectly legal for doctors to prescribe it off label once it's been approved for something else. President Trump said it offers hope. That was a correct statement. He did not promote it. He didn't push it. All the things that the media has since said was not what he said. I heard what he said that day. It was perfectly appropriate. It was meant to encourage Americans. We had something that might be helpful and that it would be done in conjunction with your own doctor. And suddenly we started within days having several Democrat governors, Cuomo in New York, Sisolak in Nevada, and Whitmer in Michigan, start issuing these emergency order restricting hydroxychloroquine to hospitalized patients. That's exactly the opposite of the time it should be given to be effective. They were not physicians. They should not have been making medical decisions based upon their political beliefs.
Well, I want to talk a little bit about, I want to talk a bit about that political belief. I mean, it seems to me that we would assume that everyone would be on the same page in terms of trying to stop this virus and try to protect people. And the fact that they would go out of their way to stop a particular medicine that has proven to be effective around the world, I mean, what are they? And the media would back that. I get the fact that they hate Donald Trump. I understand that to an extent, but is their hatred so utterly depraved that they would actually advocate that people die and that people get sick needlessly just to spite Trump? I mean, what the heck is going on with that?
I can't read their mind. I cannot make sense of it medically. It is unprecedented in my entire career for practicing physicians with legal authority to take any FDA approved medicine and evaluate a patient and decide to use an FDA approved medicine for a patient for a new use. We've always had that ability under the FDA regulations. And why that is being overridden by political people, governors who then direct their medical boards and pharmacy boards, I've never seen it in my entire career. Neither have most of the doctors that I've been on conference calls with. None of us have seen anything like this. And part of the problem, those of us in medicine just simply don't have a platform to reach more consumers the way the mainstream media does or the way the politicians do. And so a counterbalancing, medically accurate information base has been hard to come by for a lot of people. It's one reason I started writing the editorials on this subject, and they were released by our medical organization, the Association of American Physicians and Surgeons, because we're trying to get our medical expertise more broadly applied to help people at a time of confusion and misinformation and fear mongering. And it's kind of like I feel a little bit like a salmon swimming upstream against Niagara Falls some days,
Right.
because we were having trouble getting the word out. Thank you for doing this show.
No, I mean, and I have to tell you that the ban on discussion of hydroxychloroquine is so pervasive that I'm afraid to put the word hydroxychloroquine on a tag on this YouTube channel because my show could be taken off the air. I mean, it's a very strange thing.
The censorship around this has been, again, unprecedented in my life. It reminds me of the censorship that we encountered on the educational trips that my husband designed for us to go into the Soviet Union in the 70s, Eastern Europe, and Red China in the 1970s. Censorship was total at that point. We are seeing that now, and I've never seen anything like this in my lifetime.
And it's a complete violation, as you point out, interestingly, of conventional function of doctors and of hospitals and of the medical profession, who are allowed, especially in a time of emergency, to use experimental drugs. That this would be banned like that.
Experimental. Hydroxychloroquine and chloroquine are not experimental drugs. They went through the formal clinical trials, randomized clinical trials for approval for malaria and then for approval for 2 other uses. And they've been shown in basic science studies as recently as 15 years ago to be very potent antiviral medicines against this family of coronaviruses, SARS-CoV-1. That is not experimental. It is just staggering how it has been misdescribed and inaccurately described.
Now, why would Dr. Anthony Fauci be soft peddling the use of hydroxychloroquine?
I can't explain it. He clearly has been at NIH for 35 years. The study done at NIH and CDC in 2005, he has to know about. It was published, was part of their agency. They were looking at it in the viral diseases that he was involved in studying. They were looking at it with SARS, the COVID-1. And for him to not address that in a balanced way in his role now, I am very concerned about that. I think it's unethical to, in my opinion, I would never get in a public setting and present such one-sided information. I'm happy to talk about both pros and cons of any medicine that we discuss. He has not had one positive word to say about hydroxychloroquine that I've been able to find in this whole time. And that doesn't make any sense when it's been safely used worldwide for so many years. The CDC website even says it's so safe, we recommend it for nursing mothers and pregnant women if they are in malaria-prone areas. So why it's being demonized at this point is just
Incredible.
absolutely, it's frightening actually,
It is.
because lives are at stake and
That's
job
right.
livelihoods and the economy, the stability of our country is at stake. I've just never seen anything like it.
Now, I mean, this is a question again about hydroxychloroquine. Is there any evidence that this drug could be used as a preventative? Could you take this to in advance, and would it help you develop any kind of immunity?
There's actually a lot of evidence that it's prophylactic. India is already using it for that very purpose. They have a prophylactic protocol on the website for the India Council on Medical Research, have issued guidelines from the government of India. Brazil is using it that way. So is Costa Rica. So are areas in.
Mhm. Now, is it possible to get hydroxychloroquine legally and ethically by an American citizen? Okay. The doctor is freezing up on me here, so we're having a little technical problem. Sorry about that. Um, I will post the information on the program so you can get in touch with my guest and her clinic, Dr. Elizabeth Lee Vliet, and the clinic Vive Life Center. And I guess, I want to thank you for joining me this afternoon, Dr. Vliet. And I hope to have you back as things progress. And listen, have a great day. And Hank, thanks for joining me, everyone. Take care.